Welcome. Forward head posture, a major problem to spinal degeneration, pinched nerves, as well as disc herniations. I want to review a specific technique that I think is a fascinating way of understanding the mechanics of how your neck should or should not work. We talk about people reading in bed, on their tablet, looking down on their smartphone, on the computer, the forward rounded shoulders, forward head translation, causing excessive stress upon the neck and shoulders. A normal lordotic curve, the weight of the head being 12 pounds, being equally distributed upon the cervical spine, the neck, on the back part of the facet joints, on the cartilage where everything sits perfectly. As the neck goes forward in a forward head posture, the weight distribution changes, causing compression and more load upon the disc spaces which are sitting between the vertebral bodies. Just 1 inch going forward is an additional 10 pounds, being 22 pounds of load. 2 inches is another additional 10 pounds, being 32 pounds. 3 inches, 42 pounds. Just 3 inches when your head goes forward, 42 pounds of load, of excess load that the back of the ligaments, muscles, tissues, and discs have to withstand, leading to further, quicker, more rapidly degenerative changes, although silent until the later phases. This precisely puts more pressure on the nerves, causing dysfunction and pain. Imagine how many people spent hours after hours, weeks and months after years in this particular position of forward head posture. Eventually it's going to catch up with you. I ask you to pay attention to this technique to give you a better understanding precisely what you could be doing to help this condition. People ask me all day long in emails, how should I sit? How should I lie down? What's the best position to put my head in? How I read, how I'm on my tablet, texting, on my computer. Well, the most important thing you can do is try to focus of keeping the ears in line with the shoulders. The more your ears go forward, the more load the back of the neck has to withstand. If you are a post-surgical condition or due for surgery, or if you have herniated discs or any kind of pinched nerves or degenerative changes, or whatever pathology you have, it all works the same way. You must maintain good, proper posture. This technique I've shared with patients, students, people along the world, as well as you listeners. This is a great technique that you should really get the concept. If you get this concept, this is really going to help your neck and preserve your neck and really allow the healing to continue to move forward. I want you to take 2 pens and imagine these 2 pens as one piece of long steel. Now it can't be because we can't put it through the ear to the other side. But if you take the 2 pens and just put it in the outside of the ear canal, do not put it inside the ear canal, just lightly put it on the outside of the ear and imagine that you cannot move your head anywhere below these 2 pens, which is that one long rod of steel going through your head. So look, if I turn sideways, it can only pivot up and down this way. It can't go this way. Okay? So in other words, we just want to jut the chin down and jut the chin up. This is the way that you're going to start looking down. And notice that your ears never go forward. Your ears never go forward. You never put load upon the neck or the discs or upon those nerves. So when you're reading below you or whatever it is or whatever you're doing, you just jut the chin down. Use your eyes. If the texting that you're doing down here or reading, use your eyes. Just jut the chin up and down. Remember, you can never bend the neck below this rod that's going through your ears. And if you just remember that and get the feeling that you're only jutting up and down rather than going forward, we don't want those ears to go forward, you're going to really preserve your neck, help your neck repair and heal. Because even if you're having problems at this moment with disc herniations, post-surgical problems, spondylosis, whatever type of encroachment or spinal stenosis, whatever you're having, if you follow this technique, you're going to allow things to repair quicker. You're going to preserve the neck to prevent excessive degenerative changes in the future. Please leave your questions below. I ask you to please share this video with others so they can benefit. Subscribe if you haven't so you can continue to receive great educational, preventative information for you and your family. And most important, make it a great day. I'm Dr. Alan Mandell.